Fibroadenoma is a benign, non-cancerous breast tumor composed of glandular and fibrous tissue. It is one of the most common breast lumps in young women, particularly between 15 to 35 years of age. Types of fibroadenoma. 1. Simple fibroadenoma. Uniform tissue does not increase breast cancer risk. 2. Complex fibroadenoma contains cysts, calcifications, or other changes, slightly increasing the risk of breast cancer. Giant fibroadenoma, larger than 5 centimeters, can cause breast asymmetries. Juvenile fibroadenoma, seen in adolescents, may grow rapidly. Causes and risk factors. Hormonal influence. Estrogen and progesterone stimulate fibroadenoma growth. Family history. Increased risk if first degree relatives have had fibroadenomas. Oral contraceptive use before age 20 may contribute to growth. Allopathic treatment options. Observation. Small asymptomatic fibroadenomas are monitored over time. Surgical excision recommended if fibroadenoma is growing rapidly, the lump is painful or disfiguring, there is suspicion of malignancy.
Cryoablation, freezing technique to shrink fibroadenoma, less common.
Hormonal therapy rarely used but may involve tamoxifen in severe cases. In India, this is the most used therapy challenges in allopathic treatment. 1. Recurrence. Many patients develop fibroadenomas again after surgery. Surgical risks. Scarring, breast deformity, pain, and recurrence. Limited non-surgical options. No guaranteed medical treatment to prevent regrowth. Why should women try my homeopathic treatment for fibroadenoma? Non-invasive holistic approach, no surgery, no scars, no risk of post-surgical complications. Focuses on hormonal balance, immune modulation, and constitutional healing. Prevention of recurrence. Allopathy fails to prevent new fibroadenomas, but I treat the underlying hormonal imbalances. Proven clinical success. I have successfully treated large recurrent fibroadenomas even in patients who had surgery before A. Safe for all ages, can be safely used in young girls and women without side effects. Effective in multiple breast conditions. I just don't treat fibroadenoma but also address cyclical mastalgia, fibrocystic changes, and hormonal disorders.
Why my group, Breast Health Healing, is valuable for women with breast conditions.
Real case studies demonstrating successful fibroadenoma resolution without surgery. Scientific holistic approach combining homeopathy, lifestyle changes, and natural healing. Education awareness helping women make informed choices about their breast health. Support community, a space for women to share experiences and gain confidence in choosing and knowing various perspectives of treatment for their conditions.